$591 million is no small amount of money, and Zimbabwe's President Emmerson Mnangagwa says that is the total received from companies and individuals in funds illegally stashed abroad. This comes after a 90-day amnesty had been given to Zimbabweans to return monies taken illegally abroad. The amnesty period expired last week, but $827 million is believed to still be outstanding. Mnangagwa had announced a 3-month amnesty for the return of public funds illegally stashed abroad when he was sworn in November after a de facto military coup forced Robert Mugabe to resign. Staying in Zimbabwe, doctors at public hospitals across the country have gone on strike, demanding better pay and working conditions. A spokesman for Doctors' Union stated that patients have been left under the care of nurses in the meantime.
Many state-run hospitals across Zimbabwe are struggling with lack of equipment and drugs and financial insufficiency. This has prompted doctors across the country to go on strike, demanding better pay and working conditions. According to the spokesman of Zimbabwe's Hospital Doctors Association, the government had not, as agreed 4 years ago, increased on-call allowances for doctors from the current $1.50 per hour to $10 per hour, and has failed to fulfill other promises for better compensation and working conditions. Opposition leader Nelson Chamisa recently visited public hospitals to assess the situation.
We need to make sure that we deal with this problem and deal with it once and for all. This is why we are calling on government to be serious. If the crisis is beyond them, beyond their capacity, they must simply be able to be frank enough to the people of Zimbabwe, but also to the government in waiting, to say that we are overwhelmed, please help us by kicking in. We are ready to deal with these issues because we have answers and solutions to such problems in terms of our health plan and health policy.
The action is the first major labor dispute under President Emmerson Mnangagwa, who replaced Robert Mugabe in November. Wilbert Munyazi, a resident of Harare, has been waiting for over an hour to have his leg checked at the Harare Central Hospital.
We have many problems because of the doctor's strike. New patients are just sitting in wards without being seen by a doctor. The nurses are overwhelmed. They can't do anything.
Unemployment remains above 80%, and the government still struggles to pay workers on time, which prompted frequent public sector strike actions under Mugabe.
Well, standing by more from Zimbabwe is Zimbabwean journalist Nigel Nyamutumbu. Hello, Nigel. A pleasure to have you on the program. Let's talk first about the $591 million that was returned. Can we attribute this to the success of the amnesty program?
Well, look, thank you for having me. I would say it's yes, part of the amnesty, but in all honesty, I think that figure, that $500 million, for starters, it's while it's something, it's really just a drop in an ocean as to the amounts that are paid to have been externalized in Zimbabwe, and to the level at which they were gaps of funds that were externalized. So yes, to say we have recovered $591 million, which in essence has not yet translated into any has made any contribution to our fiscus at all, because we still are facing macroeconomic challenges at a very high level. There is inflation is really now gone up. There remain to be serious cash challenges and so forth. So on one hand, you would see, well, yes, at least there is $591 million recovered, but the bigger question is, where is this $591 million? to say the least. Whether you look at it from inflation figures, the official ones, which are just between 3 to 5%, are not what is obtaining on the ground. The case in liquidity challenges, official figures obtaining on the ground are totally different. So yes, it may be good that the government has recovered some money. The figures that they are dwindling around leave more questions than answers.
All right, Nigel, let's quickly get your thoughts on Zimbabwe's healthcare. Has there been any word from the government on the doctors' strike, and how much can the nurses take without the doctors?
Well, the government is essentially still stuck in the Mugabe regime's a type of command economics, where they expect professionals such as doctors, whom they have not been paying, to get back to work merely because of the assurances that have been made by the government. Right now, it is nearing a crisis in the making, because we, the reports of death that are avoidable and so forth, should patients have been properly attended to, are on the rise. And it's because, on one hand, government is trying to commandeer the doctors back to work, but on the other, the doctors are also, putting on the table their case to say we also have families that we need to take care of. We also, they have legitimate concerns, and the sooner that there is an amicable solution to this, the better. Let the crisis get to epidemic level.
Thank you so much, Nigel. We'll continue to speak to you as things unfold. Nigel there, Nyamutumbu, speaking to us from Zimbabwe.